From the Cancer Association of South Africa joins me now via Skype. Michael, good to have you, and thank you so much for your time. This is such an important, conversation because I think even the Department of Health has reiterated that those with chronic illnesses are quite at risk at this time. But just from a perspective of cancer patients, how life-threatening is this time for them, especially, while we're trying to curb, COVID-19, they too have another issue, which is, of course, cancer.
Yes, you're talking about chronic illnesses, and added to the fact that cancer patients have a chronic illness because it's something that extends over months and years sometimes. They also undergo certain forms of treatment, and I would like to mention here chemotherapy, radiation therapy, adjuvant therapy, or any other form of therapy, including surgery, which further affects their immune system. For instance, we know that radiation therapy and chemotherapy suppresses the formation of white blood cells, and we know that white blood cells are absolutely crucial to maintain our immunity.
Yeah, and beyond the work that you already do, Michael, for cancer patients, what else do you offer, especially during this time of, the lockdown, the national state of disaster, but also as we have various quarantine sites around the country?
Yes, I can tell you we're so thankful towards the government and through the Department of Health that they have allowed us to keep our cancer care homes open. These are special centres in the major towns where cancer treatment takes place, where we provide accommodation to people coming from outlying and rural areas. So we were allowed to keep these open, and we transport the patients to their treating centres every morning, and we take them back in the afternoon and provide them with meals and accommodation. And we're very thankful for that, because there are so many cancer patients from rural areas and those that cannot afford to be hospitalized, etc.
Yeah, and with that being said, Michael, are you able to confirm right now whether you have received any COVID-19 patients who've tested positive, equally, still on radiation or even, trying to treat their cancer?
Not one, but we are in close contact with the various oncologists at practically every one of the cancer treatment centres, because we ask them also to be on the lookout should they suspect that any of the patients become infected with the COVID-19 virus, that they will inform us, because that will mean that our whole cancer care centre will then also have to be quarantined.
And the reason we're also having this discussion is because we know that cancer patients are at higher risk because their immune system is already weakened. So for those who haven't tested positive, what advice would you give them in terms of keeping healthy and also their immune system strong?
The most important message that I can give to any cancer patient or any cancer survivor: know your body. If you find anything different today than it was yesterday or the day before, please report it to your treating physician, your oncologist, and have it seen to. It is absolutely crucial that we do not wait until you develop very high fever with a dry cough and all the other major signs and symptoms of the coronavirus disease.
Priceless advice. Thank you so much. Michael Herbst from the Cancer Association of South Africa.